first episode of Epidemiology Explained. This week we're going to be talking about the definition of epidemiology. We're going to be discussing what it is, what you can do with it, and how it can work best for you. So stick around and let's explore some epidemiology. Epidemiology is the study of disease distribution within populations. As a result, Epi helps us determine the cause or etiology of and risk factors for a given disease or set of diseases, which populations are affected by a given disease, the extent of the disease burden and the population's risk for that disease, and how the patterns of disease and burden change through time. Also, Epi helps us understand the natural history or natural progression of disease, and also gives us a way to evaluate methods of controlling and preventing that disease. When discussing prevention, epidemiology predominantly focuses on primary prevention, which is action taken to prevent currently healthy people from getting a disease. The best example of this is giving vaccines. Primary prevention can also be environmentally focused through reducing or eliminating exposure. Secondary prevention refers to identifying those who already have a disease earlier than the disease would have normally been identified. This is usually done through screening programs. Lastly, tertiary prevention aims to make those with a disease more comfortable in terms of disease complications. This can be done through medical treatment, physical therapy, or even support groups. How is disease burden monitored and identified? Surveillance allows epidemiologists and other health professionals to monitor changes of distribution and frequency of disease and/or their risk factors. Surveillance can be passive, where data is made available for use through requirements or gathered by medical professionals. Or it can also be active, where health professionals gather the data of interest themselves. They can do this by getting information from medical clinics or hospitals, interviews and surveys, or reviewing health records. Passive surveillance is cheaper and more quickly acquired, but active surveillance is generally more accurate and more robust because it's gathered specifically and intentionally by those who know exactly what details of the desired information they need to obtain. We've now covered some of the basics of what epidemiology is and how it helps us. We'll see you next time to discuss more about what epidemiology can use in terms of measuring disease burden and mortality.
There's a high-density molecular process involved in this bonding agent.
It's a sticky situation.
Good one!
Thanks.